would education change if we treated educator wellness as essential to student achievement? At Professional Inspiration, we believe educator and student wellness isn't optional, it's foundational. Our online courses, nationally accredited, are designed to inspire and empower and inform educators because when educators are well, students thrive. Explore our courses at professional-inspiration.com. Stay well.
Welcome to Season 4, Series 3 of Questions You Didn't Ask. I'm Niasha Fray, CEO of Niasha Fray Consulting, LLC, where we design community-informed solutions to health equity problems and shine a light on the questions that too often go unasked. This series is called Beyond the Band-Aid, Prevention, Power, and Public Health Equity, and I am thrilled to be joined by my longtime friend, former UNC Gillings classmate and fellow believer in justice-centered public health, Dr. Paul J. Fleming. Paul is an associate professor of health behavior and health equity at the University of Michigan School of Public Health, a committed researcher and educator, and the author of the powerful upcoming book, Imagine Doing Better: Why Policies Backfire and How Prevention Thinking Can Change Everything, which you can pre-order now through bookshop.org or directly from Hopkins Press. Paul and I first connected as doctoral students in the Department of Health Behavior at UNC Chapel Hill, bonding over big ideas, shared curiosity, and a drive to change how we approach public health. His journey from growing up in Glen Ellen, Illinois, to working on Medicaid policy, to serving in the Peace Corps in Nicaragua, has given him a front row seat to understanding how poverty, politics, and power shape the health of entire communities. Paul's framework for prevention thinking is both simple and radical. It starts with root cause analysis, asking why problems like violence, chronic illness, or educational inequities exist in the first place. Then it prioritizes primary prevention, stopping harm before it begins. And most importantly, it centers the voices and needs of the people most impacted. Paul draws inspiration from the disability rights movement's powerful principle, nothing about us without us, a rallying cry from South African disability activists that emphasizes the right of impacted communities to shape decisions affecting their lives. Here's why this conversation matters now more than ever. Chronic illnesses make up 90% of America's $4.5 trillion healthcare costs, draining $168 billion in lost productivity each year and projected to hit $2 trillion by 2050, according to Centers for Disease Control and Prevention. Racial and ethnic health inequities cost the U.S. economy $451 billion in 2018 alone, and could top $1 trillion by 2040 if left unchecked, according to the National Institute of Health, as well as Blue Cross Blue Shield of Massachusetts. Meanwhile, current federal proposals could slash over $1 trillion from Medicaid, putting 10 to 12 million people at risk of losing coverage, closing rural hospitals, and forcing families to choose between food and life-saving care, according to reports by Axios and the Wall Street Journal. These are not just abstract numbers. These are the lived realities of our neighbors, friends, and families. In this series, we're asking, what if we stopped patching broken systems and started building ones that heal? What if we rewarded care instead of punishment? And what's possible when we lead with imagination, equity, and collective action? Whether you're a student, policymaker, health professional, or community advocate, this series will challenge you to think differently about what public health can be and how we all have a role in creating it. If you want to follow Paul's work, pre-order his book, or subscribe to his thought-provoking newsletter, visit pjfleming.com and pjfleming.com/newsletter. newsletter. You can also find him on LinkedIn and Twitter at pfleming3. Let's move beyond the Band-Aid and imagine what's truly possible in this discussion. Paul, we have been looking forward to this conversation for quite some time. Oh my goodness, I'm so glad to have you with me on Questions You Didn't Ask for the first time. I'm not going to say it's the last.
Well, I'm excited to be here.
Great. So share with me and my audience, why did you agree to be on this show, Questions You Didn't Ask?
Well, of course I would want to be on this show. One of the things I think listeners should know is we go way back, right? So I remember some wonderful conversations that we had when we were in grad school together. And I've been seeing and listening to your podcast ever since you started it. And so the invitation and opportunity to come chat with you again on here, I couldn't pass it up.
I agree. That's one of the things I've been looking forward to. And it's just nice that we get to share these conversations more broadly because, we have a lot to share and a lot to say about some really important topics that I think our audience is going to resonate with. But before we get into our expertise and our secret sauce, let's start with who you are and how you got here. So tell us about your path from growing up to becoming a professor at the University of Michigan, Go Blue, School of Public Health.
Thank you. I'm impressed to hear you say "Go Blue" as a Tar Heel fan.
It happens.
Well, that's such a fun question to start with because I think oftentimes we don't take the time to really get to know each other's origin story. And I don't know, maybe we did talk about it back in the day, but here's an opportunity. So I grew up outside of Chicago. I grew up in a suburb of Chicago called Glen Ellen. And it was a well-resourced environment. I didn't realize it at the time because it was just all I knew. But as I went on in my career and my life, I realized just, how many resources were there available to me. I went to public schools that, by and large had the resources they needed to help students succeed. And, from there, I went on to the state public University of Illinois, another Big Ten school. And I studied political science and I studied Spanish. And, I was thinking I'd make a career somewhere in the public policy realm. I wasn't really sure. I didn't have a topic I was interested in. I wasn't really sure. But I thought, I'm interested in government and politics and those kinds of things. And I'd love to be a part of the policymaking process. And along the way, I always, and I think growing up, my parents instilled in me this desire to give back and participate in not only participate in your community, but kind of give back to the community and help people that are less fortunate than you, et cetera. And so since I had been studying Spanish, the Peace Corps was something that was present in my mind as I was going through college of this would be a really interesting opportunity to use the Spanish that I've been learning, work in communities, helping them thrive. And I was really eager to live outside the US at that point. So even though I kind of had public policy in mind, I took what I thought was a little bit of a detour, joined the Peace Corps. I spent 2 years as a community health volunteer in Nicaragua. And that really that changed everything for me. Of course, going to college and getting out of the place I grew up also exposed me to a broader range of experiences in the US.
Mm-hmm.
I met types of people that I hadn't met before. I learned more about rural communities, urban communities, people growing up in all different settings, right? So that was part of my college experience. But then really going to be a Peace Corps volunteer and living in what was at the time the second poorest country in the Western Hemisphere was really just eye-opening in the sense of you really saw you saw how communities came together to support each other in a way that I didn't always see in my community growing up because the resources were there and provided for. I think you really see what poverty, what a negative impact poverty has on people. And also the happiness and the talents and everything of communities that are living in poverty. And through that work, though, I was assigned to be a community health volunteer. Now, I have to tell you, Niasha, before that moment, I did not care about health at all. I was the person who, didn't really like being around blood or anything like that. I didn't particularly care much about health issues. I think if you asked my friends, they wouldn't think I was particularly healthy or making very healthy choices for myself. So in a lot of ways, health, and now my whole career in public health, it wasn't always an obvious place for me to go. But with the Peace Corps, they saw my background, they saw my Spanish speaking, and I did at one point do a public policy internship that had something to do with Medicaid. And so they said, oh, Medicaid is health. Why don't you go be a health volunteer? And so that, anyways, I worked as a community health volunteer. And in the Peace Corps, you partner with local communities. You only go to communities where you're invited in. So these are a lot of lessons that I carried forward, right? Of like the partnerships, the people have to want to be working with you. You can't just impose yourself upon them. And then also, you're working in partnership. It's not just the Paul Fleming show trying to go do work in this community. I'm asking questions. I'm learning what the priorities are. I'm following other people's leads. So that was really, that was, as we get into my public health career, that was the foundation I was starting with. And I learned that I really love this thing called public health. Like the opportunity to work in partnership with people to help people be healthy. It was at that moment I also learned that health isn't just about disease. It's about thriving. It's about helping people have the resources they need. It's about education and transportation. And it's about all these different things. And I really credit, one of the Nicaraguan women I worked with was named Xiomara. She taught me all of that. And she was actually kind of a revolutionary in her country. I mean, a literal revolutionary participating in the Revolutionary War. And she taught me this ethos of health as a human right and this ethos of working and building relationships with people. And all of that really stayed with me. And so anyways, I dwell on that Peace Corps moment because it taught me so much. Yeah. And from there is when I said, okay, I've learned a lot from this experience, but I would like to get some formal training in public health. And so I went on to do a master's degree. And then at that point, I sort of realized that research was, and public health research in particular, because not all research necessarily works this way, but public health research is an opportunity to do community work and really help partner with communities to uncover what's going to work well in this community, what doesn't work well, how can we take those steps forward together? So that was the type of research that I was really eager to learn more about. Sometimes we call that like community-based participatory research. I did some training in that. And then as I did more and more work, I was working with immigrant communities in the US. I was still doing a little bit of global health work. And then more and more today, I've started doing work that's partnering with public health institutions, thinking about how you embed equity into that work. And so I know that's a long-winded answer. And
it was supposed to be.
Yeah. But I really think, where I starting from a place where I did have resources and then having the opportunity, either through my training or through Peace Corps or through different jobs that I had over the years, to really see the wide range of the human experience and what people are facing, and just learn more about just how many communities there are in the US, throughout the world, that don't have the resources, right? And oftentimes those things are connected. The fact that my community had resources was connected to the fact that another community didn't, because we weren't distributing those resources equally, right?
Yes.
And so as I came to understand that my privilege was connected to other people's disadvantage, that really motivated me of like, this is what I want to dedicate my work to. And I know, I'm not going to solve it alone. I'm not going to be able to tackle it alone, but this is the area I want to work in for my whole life.
If you're enjoying the show as much as we love creating it, consider showing your support by buying us a cup of coffee. Visit buymeacoffee.com/Niasha Fray O. That's buymeacoffee.com/Niasha Fray O. All one word. Each cup is just $5, and every single one helps us continue to produce, develop, and sustain the high quality content you've come to expect from Questions You Didn't Ask. Thank you for your continued support, and let's keep the conversation going. I mean, it is a lifelong journey if you're going to, completely follow your heart and your spirit to do this work that is not mainstream, is not popular, but is so needed, and some of it is a part of, I know for me, what makes me feel alive and what makes me feel human. And I definitely get that from you. I'm so glad that you talked about, how these different experiences exposed you to different communities, and that it kind of stripped away a lot of things that you, like you said, you took for granted. That's natural. I always sometimes call that process of what it is to be in innocence. I didn't realize that innocence is like in no sense. You did not know, right? These are things that you just did not know as a child, as an adolescent, as a young adult, until you became, or you had some sense, right? You gained some sense, some perspective. Right. And the sense is not just knowing, but it's also touching, feeling, hearing, a lot of hearing, speaking. All of those senses, have been activated in you. And so through that process, your whole life outlook changed.
Mm-hmm.
And that's just really powerful.
Yeah. And I think those types of experiences can be all around us, and we have to be open to them, and I think that was in some ways the beauty of the Peace Corps experience is the Peace Corps itself really trains you and sets you up saying, you don't have the answers. You don't know. You better go in there and listen, right? And so, it helped really just open myself up to being able to hear it. Because I do think, especially as we go through our day-to-day life, and if we're distracted and other things, there may be these powerful experiences waiting in front of us, but if we're not open to it, we're just going to keep moving forward in the same way.
Mm-hmm. So speaking of moving forward in the same way, and oftentimes getting caught up in what it is that needs to be done, I think it's important to call attention to the fact that you are a white man. You are what we consider a heterosexual cisgender man, meaning you were born male and you live as a man. That is your identity, and you are those things in America. That is the first thing that someone is going to notice about you, whether they have the privilege of talking to you and getting to know you or not. And because of that, that shapes the world that you engage with and interact with. But just from your own words, how would you describe how your identity has shaped you and how you see the world? And specifically, let's start there. How has it shaped you and how you see the world?
Yeah. And I mean, that's another big question. You're good at throwing the big questions my way. and I know they'll keep coming. But yeah, I mean, of course, our identities really do shape who we are. And so I think, being a white man, and that's the other thing, right, is the way that whiteness can be invisible in this country, right? It's to be white is almost to not be racialized in the same way that other groups are. And so of course I am racialized as white, but I'm just saying culturally we think of whiteness as like the absence of race, or
the default.
Right. The default. Exactly.
The baseline.
And so frankly, I didn't think a lot about my whiteness growing up. My town was definitely majority white, vast majority white, but not exclusively. There was definitely some diversity of racial and ethnic identities, but it wasn't something that was talked about much. It was very much the sort of default race. It wasn't something that I reckoned with. I thought a lot about, to be honest. So it has really been a journey for me to recognize that I am racialized. I live in a racialized society, and that whiteness is, privileged and advantaged over other racialized groups. And so even seeing the lens in which the town I grew up in, right, that it was well resourced because it was predominantly white, or that those things are connected, right? And that some other communities that are not predominantly white and are not resourced, it's partially due to that fact, right? So reckoning with that. And then I think being not only just white, but a white man in our power hierarchy, that is the pinnacle, right? So I think reckoning with and that, yeah, I mean, just to be frank, that it feels uncomfortable. I'm not trying to be at the top of the pyramid. I'm not trying to hold that. But it's a reality. And so I think over the years, I think I've tried to do a lot of work to understand my identity better and where it fits in. And then I think the other thing is, and I didn't mention this earlier, but actually when I was getting started in public health work, some of the work I was working on was work directly with men around masculinity and the ways that masculinity can encourage men to choose behaviors or do things that are harmful to themselves, to their partners, to their community, being violent, things like that. And so that process alone really helped me unpack masculinity and patriarchy and really think deeply about that. But frankly, I kind of went through that journey before I really went through a journey thinking deeply about and trying to unpack my race and racial dynamics in our society. But in some ways, thinking about it through a gender lens first really helped give me the tools and some of the language to think about how these social structures of gender and race do create power hierarchies in our society, and that those power hierarchies are harmful. And so that was a process that I had to go through. And, I can't separate my identity from the work I do. I am a white man doing work on health equity. Much of my work partners with people and communities that have identities that are different than mine. And so I think from that lens, one of the approaches I take is back to, a lot of listening and a lot of relationship building and a lot of not trying to put myself at the forefront, but rather understand what other people think is needed and then see how I can support moving that work forward. And I can't say that I do that perfectly all the time. Absolutely not. But that is, I think, a place I've come to. And I think how my identity as I do this equity work comes into play.
Yeah, I asked that question because, commonly we talk about terms like intersectionality, right? And we usually talk about it from the framework of, the original author, who is a Black woman. And one of the spins that I like to take on this concept of intersectionality is that, even though it does help us to unfold each layer of our identity, right, which depending on who you're talking about, comes with a certain level of disadvantage, right? But what I've noticed, and what I've noticed is that when you take that concept and you place various individuals in different settings, in different communities, what was a disadvantage can now become an advantage. What was a privilege can turn into the opposite, right? Yep. And I find it interesting. First, I'm thankful that I have a friend like you, Paul. And I will say it, you're not the only friend, but you're a part of that community of friends, of people who happen to be white. And I make that classification because there's a lot of negative connotation that comes with the white community in general, writ large, right? There's some unfortunate patterns that are associated with the white community writ large, especially from a political sense. So when I think about people in my community that I can have these conversations with and be honest about, I'm thankful for that because it allows me to dig a little deeper and have more understanding, have a different, share my perspective, but also, like you said, listen and learn and be able to unpack some of that stuff. And I think that it's really interesting too, that you talked about how better understanding your maleness, your masculinity, and not just yours, but what it is to the greater population. What are those kind of common characteristics that we associate with masculinity, whether that applies to you as an individual or not? Going through that practice and that study gave you some tools and potentially some humility that allowed you to dig a little deeper when it came to unpacking whiteness and how your white identity or your whiteness, or however you want to call it, has shaped your privilege and has shaped your opportunities. And even though, like you said, these things that we experience is not what we sign up for. Like you talked about, I'm not asking to be at the top of the heap, but because of this society and this culture and these labels and these values that we've placed on our identities, it's there, right? Like I didn't sign up to be discriminated against because I'm a Black woman, but it's there and I have to deal with it. And what am I going to do with it? And so that becomes the question.
Yeah. Well, that point about what are you going to do with it? I mean, I think that's the other thing that in a way motivates me, is because, I mean, I'm pretty clear that part of the ways that I get to be a professor at the University of Michigan is because of privileges that I've had over the years, right? And so being a professor at the University of Michigan also comes with some power, not nearly as much power as I would want, right? But you have some.
You ain't got no magic wand. What you talking
right,
about?
exactly. You have some decision making, right? You participate in decisions about admissions and scholarships. You participate in what the curriculum looks like. You participate in reviewing grants for what types of things get funded. And so if all of us aren't intentional about using the power that we do hold in ways that advance equity, that make our society better, that lift up people that are disadvantaged, then we're doing it wrong. I'm taking up space from somebody who could do that work, right? And so I have to be very cognizant of that, of the position that I hold, which is connected to my identity. And then what am I doing with it to undo those systems that gave me those unfair advantages?
So, Paul, you and my people who happen to be white, my community of brothers and sisters in this fight to advance health equity. And unfortunately, it is a fight. I hate to say it. It's a fight because there are way too many people who don't try to change anything. They're completely fine with the way things are. Actually, they'd rather fight you to keep their position of power and privilege and ease, right? I mean, I can only imagine if you wanted to maximize, for those who do maximize their whiteness, who do maximize the privilege of maleness, who do maximize the privilege of being white, male, and heterosexual in this society in America, like they've got it made in the shade, man. Made in the freaking shade. Why would you want to give that up? So I've got to ask you, I mean, just go there with me and my audience and tell us, why does health equity matter to you? I mean,
I'm struggling to find the words because it is one of those things that it's hard. I mean, I think those of us who are in it, it's hard for us to imagine, well, why wouldn't you care about this, right? So that's why I was stumbling a little bit at first, but I think it matters to me because I know I'm connected to it. I think some people who are in the position of advantage don't see themselves as connected to those who are disadvantaged, right?
Mm-hmm.
Those who are disadvantaged, whatever's going on with them is their own thing. For me, I'm very aware that all the advantages I experience as a college professor, I'm not wealthy, but all the wealth that I experience, all the resources I have at my disposal, those are connected to the systems, and they're connected to the disadvantage that others experience, right? So a simple example of this, right? Like I save money on my grocery bill because there are people and workers who are underclass getting low wages in this country to pick the fruits and vegetables. They're not having their human rights protected. They're not earning a living wage. And right now they're being, disappeared and deported and other things that are horrible, right? But for me to sit here and pretend that I'm not connected to that system that has created that is just not true, right? And that's just one small example. And so given that I'm connected in these different ways to harm that is occurring to other people, I feel a responsibility to do work that is trying to change that system. And I think that's part of what lights the fire under me. And that's why I care. And I think, for a lot of people that don't care, I do think it goes a little bit back to that innocence comment that you made earlier. Some people just haven't had the opportunity to see the ways in which these systems work and they're connected, or they're not even really aware. But I think you're also right that some people see it and they just want to hold on to the power. And so I think that's a different challenge for us to deal with in society. But I think, again, part of maybe how I was raised is you want to share with other people, right? If I have stuff, I want to make sure other people have stuff too. If I have safety, I want other people to have safety. If I have an opportunity, I want to make sure that other people have an opportunity.
Yeah. And that ripple effect. I mean, I think that it's interesting that you talked about, your time at Peace Corps. And granted, I'm sure, I've never been to Nicaragua. I've been to other countries that are considered third world. And I've seen different levels of poverty in other countries and in the United States that blew my mind, right?
Mm-hmm.
And I didn't grow up with a lot of money. I grew up either very, very poor, but I've seen people that grew up worse off than me, right? Like I was like, dang, I thought we were struggling. Dang, that's deep, And when you talk about that, you made sure to share. And I believe that you're sincere when you say this, because I've witnessed it myself, that the happiness wasn't necessarily contingent upon what you had in the bank or what you had on your label, you had in your clothes. The creativity, the intelligence, the wisdom was not tied to those things. And I think one of the things that can set people apart in seeing that sharing, not having all of it, not hoarding it doesn't make you happy. Hoarding it doesn't necessarily make you have a better life. Sharing it and making sure that you have people to enjoy it with you, right? And making sure that everybody has something and we have people around the table with us, that tends to, in my experience, and I would love to hear your perspective on this, but in my experience, has made me feel rich.
Yeah. I think you said it so well, is that, if we're thinking about as individuals, like what is going to make us feel like we have a happy and fulfilling life, then the accumulation of money and things, it's not it, right?
Mm-hmm.
What makes us as humans feel happy and joyful is the connection. It is the community. And so I think in a capitalist society, we sometimes forget that the thing that we want to maximize is actually happiness and joy. Because in a capitalist society, a lot of us, including myself, get stuck on the thing we want to maximize is the money. I need more money. I need more money in my bank account. If you stop and think about it, money doesn't equal joy and happiness. What we want is joy and happiness. And I think back to what you were saying about my experience in Nicaragua, a lot of it is seeing the humanity in people. And I think especially the way sometimes our news media works, or the ways that we're isolated from each other in the US, your vision of a different community than your own is often some sort of stereotype. It's often some reduced idea of what that community is or isn't. And the reality is, no matter what human community is, there is pain and there is joy. There is creativity, there is hard work, there is the range of human experience within that community. And I think, we do ourselves a disservice when we allow ourselves to think of a different community as somehow not as complicated as our own community or our own family or our own experience. And so absolutely, people who were living in a lot of poverty, some of them were super happy and, and they made do, right? They were like, this is what I have and I'm going to do my best. Now, don't get me wrong. Those public health impacts we know about hurt them, right? Like, they experienced more health issues. Their family members died earlier than other people, right? So it's not to say, I'm not saying that they were just happy-go-lucky people that were always happy. That's not at all what I'm saying. But the point being is, that happiness and joy and the ability to experience it is human. And so we all experience it at different points. And what we want to do is we want to maximize that. And I think people who are experiencing poverty or discrimination, they have fewer opportunities, but they still persevere and experience it.
And that's a wrap on this episode of Questions You Didn't Ask. I'm Niasha Fray, and wow, what a powerful start with Dr. Paul J. Fleming. His insights on prevention, public health, and equity. Pure gold, and just the beginning of what's to come. Don't go far. Join me next time as we keep pulling back the layers in our series, Beyond the Band-Aid, Prevention, Power, and Public Health Equity. I'll see you then.